Thank you for joining us. I'm Avital Havusha. I'm the Vice President for Programs here at the New York State Health Foundation. Before we get started, a few housekeeping items. We'll be recording this webinar, and a recap with the link to the recording and other materials will be circulated after within a few days. And video and audio are disabled for attendees, but we invite you to use the chat box throughout the event to share your questions. And after some of our brief presentations, we'll be addressing questions through a Q&A period for the second half of the event. I'm going to just set the stage a bit and then introduce our speakers. So as you know, during today's conversation, we'll be taking a closer look at New York State's Age-Friendly Health Systems Initiative. As those of you joining us today know, older New Yorkers are making up a larger share of the state's population than ever before. By 2030, 1 out of 4 New Yorkers will be over the age of 60. And although many are thriving and participating meaningfully in community and family life, older adults are facing some challenges accessing patient-centered care that meets their needs and preferences. And many partners throughout New York are implementing initiatives to rethink how we approach aging and affirm the need to promote health and safety for older adults in their communities. Here at New York State Health Foundation, we've approached our work in this space from the perspective of consumer empowerment and that program area, where we've supported initiatives to promote patients as partners in their healthcare, where their voice is at the center of the conversation. And just stepping back a bit in terms of the context of where we are in New York today, and we'll jump into this a little bit more through the presentations and discussion. In 2017, AARP designated New York State as the first age-friendly state in the nation. And since then, there have been a number of health system, policy, local government initiatives to improve the lives of older adults that have followed. And most recently, that's been in the form of a proposal for a master plan for aging for New York State, with some support from a coalition of cross-sectional partners from across the state. Governor Hochul announced plans to support a master plan for aging, as well as included funds in the proposed executive budget. And so a master plan for aging, what is it? It's a comprehensive roadmap for system-wide changes and how services are coordinated, delivered, and financed. Several other states, including Texas, Massachusetts, California, have implemented master plans as a blueprint of sorts to help guide their work across sectors, including health and other social services, to support healthy aging in communities. And one of the key elements of a master plan for aging, with the recommendations from the statewide coalition here in New York, has been a recommendation to expand the Age-Friendly Health Systems initiative. And so that's why we're here today, to tell you all a bit more about how that's looked in practice, how the age-friendly health systems has played out across New York State. It's an exciting initiative. Our guest today will tell us a bit more about the 4 M's model, which really is a collective set of strategies and changes that get implemented together that result in improvements to health outcomes and better partnerships between patients and families. Our presenters are going to show us how it's playing out in practice. More than 50 health systems across New York State are working with the Healthcare Association of New York State, Haneys, through an action community, and they're learning from each other, they're learning from experts on how to implement the strategies in their health systems and how to spread it across their regions and across their hospitals and health systems. And we'll hear directly from the Bassett healthcare system to hear how that's looked for them in central New York. And our presenters will highlight some of the outcomes of that initial work. What are the partnerships looking like? What are the workflow changes looking like in their systems? And how it ties up to some of these broader initiatives that are happening at New York State. And what's so exciting about the work that I think Dora, our first presenter, will highlight for us is the extensive partnerships that have really been developed. We've been lucky to have the opportunity to partner with the New York State Department of Health and Aging, the Institute for Healthcare Improvement, and our colleague foundations at the Hartford Foundation, the Health Foundation for Central and Western New York, the Samuels Foundation, and the New York Community Trust. So without further ado, I'll introduce our guests for today. Dora Fisher is the Director of Post-Acute and Continuing Care at Haneys. Morgan Black is the Program Manager for the Age-Friendly Health Systems at Haneys. And Laura Palada is the Network Director of Quality for Bassett Healthcare System, A.O. Fox Hospital. So we have a lot to cover. So I'm going to turn it to Dora and Morgan first, who are going to walk us through a bit of the Haneys approach to this action community with health systems in New York State. They'll turn it over to Laura. And after those brief presentations, we'll make sure to have time to discuss some of the questions that you might have about how this work is going in New York State, and to give you a bit more background on some of where you can learn more about the Master Plan for Aging. So Dora and Morgan, I'll turn it to you, and then we'll come back for discussion.
Thank you so much, Avital. Thank you so much, everyone, for being here today. Really appreciate that warm welcome, and it's great. I'm scrolling through the participants, and I love seeing so many familiar names. It's just so great to be here with everyone. It has really been a journey these last 2 years, obviously in a lot of ways, but more than we even realize, and with AgeFriendly. So I'm going to share my slides. Hang on one second. All right, can you see this okay? With Zoom, you never know if other people can see what you see. Let's see. Okay. All right, well, it really is such a pleasure to be here, and I'm going to tell you a little bit about myself first. I'm Dora. My pronouns are she, her, and as Avital said, I am the Director of Post-Acute and Continuing Care for the Healthcare Association of New York State. So this means I have the privilege of supporting our member nursing homes and our member healthcare systems in their long-term care work. And I also get to help health systems across New York State take strides in improving care for older adults. So I'd like to start with a snapshot of our journey before I tell you a little bit about who Haneys is and how we got involved. So just like Avital already said, New York State was so excited in 2017. AARP says New York State is the first age-friendly state. What an honor. And everybody was so jazzed that our elected leaders said, you know what, we are going to ask that 50% of health systems in New York State become age-friendly by 2022. Of course, in 2017, we did not know what the next 5 years would look like, really, but nonetheless, it was a very exciting project for us to be asked to be involved in. So we at Haneys are very well-known leaders in leading healthcare improvement, healthcare quality improvement initiatives. And because this is something we are so well known for, we were approached to take on this work. So I just mentioned that, we have this strength in quality improvement programming. We're really known for it. We're known for our professional development programs. Haneys is a lot of things. We are the statewide hospital and continuing care association, and we work to advance health across our state by providing leadership and representation, service, technical assistance to healthcare providers and systems across the state, including post-acute and continuing care settings. So from my description, you can see why Haneys was well positioned to take on this work. When New York State leaders first decided this was something we were going to really push for, the Department of Health approached us to ask us if we could take this on. And we said, of course, we're so excited to, but this is not a project to be taken on alone. So the Department of Health did this amazing job and pulled together all these stakeholders. This is back in 2018. We all came to the table to talk about how important this was, how we saw this as the future of healthcare for older adults, and we all wanted to be a part of it. So what happened next was an incredible coalition of foundations and partner organizations all working together, making this such a groundbreakingly innovative collaboration. So today we're so pleased to have the support of our 4 funders. Avital said them already, so I won't say them again. We've got these 4 fantastic organizations that are supporting us in this work. We also work very closely with the New York State Department of Health and the New York State Office for the Aging, as well as the founders of the age-friendly movement. These 4 organizations have just been incredible, and none of this work would exist without them. So as you can see, it takes a village to do this kind of work. So now I'm going to take a step back and address why age-friendly and why now. I'm sure all of us in the audience, everyone knows that aging is a huge deal right now. The aging population is growing rapidly. It's not news to anybody. However, the degree to which that is happening is staggering, and it is radically reshaping society in every way. I've worked in the field of aging for nearly 2 decades. I saw my first boss is in the audience. I saw you there. And so I have been in this field a while. And the entire time I've had my eye on 2 people in my life, my parents, because they were the very first baby boomers. They were born in July 1946, about 9 months after World War II ended. So they're 75 today, and I see how their needs for healthcare are so different from their parents' needs. And I see how much this is changing. And I also see that they are the very beginning. If they are the first baby boomers and they are 75, it means the next 20 years are going to be a wild ride, right? So it's why I personally think that this is the most exciting time to work in the field of aging. Never before in human history have this many people over the age of 65 been alive at once. And that's going to keep increasing for a really long time. The demographics of this group are changing, particularly in our diverse state of New York, which makes it especially important for care to be patient-centered and focused on the individual and community needs. So this is when the age-friendly movement and the 4 M's enter the conversation. This is an initiative focused on the interdependent nature of these 4 evidence-based principles: medication, mentation, mobility, and most importantly, what matters. In an age-friendly health system, value is optimized for all. This means patients, families, caregivers, healthcare providers, the whole system. And this means ensuring that the age-friendly approach is dignified and respectful when caring for older people, and also ensuring that any training that is developed stresses the issue of respect and being treated with dignity. So we know New York State, we are so fortunate to have so many amazing healthcare providers. I mean, every day I'm struck by the incredible valor that we see out there in healthcare. And every healthcare provider I've ever met knows about how important each of these 4 principles are, right? That's not new information to anybody, that all 4 of these things matter. What age-friendly health systems does, though, is reorients the work of the health system so that each of these 4 M's are taken into consideration at every step an older adult takes through a healthcare system. Every interaction with an older adult in a healthcare system should have all 4 of these evidence-based principles taken into account into how care is delivered. So this initiative asks providers to reframe their thinking from "what's the matter with you?" to "what matters to you?" So it's really shocking what a difference that makes, right? So just asking, we've seen that participating health systems, when they formalize ways to ask that question of all their older patients, they have found health outcomes improve. Shockingly, they've even found costs reduced because sometimes they're doing things that are really not what the patient wants or needs. So in our conversations with healthcare providers about joining this movement, people understandably seem hesitant about, taking on a new thing, especially with everything going on in the world right now. So one thing that we tell them, this is a framework. This is not a program. This isn't something that you attend a few webinars, you fill out all the forms, you take the classes, you get your certification, you staple it on to everything else you're doing, and then you move on. It's not really like that at all. Instead, it's taking a lens, it's putting on your age-friendly glasses and looking at everything in your healthcare system and seeing if it's age-friendly and applying these principles. So rather than just piling on more work onto our already burdened healthcare providers, often this can identify work in the healthcare system that is not age-friendly. That can result in new efficiencies and it can streamline the process so everybody is better able to focus on what really matters, providing good care to older adults. So I always want to be clear that this is not really just like an extra program. It's completely reorienting the work that healthcare systems do. We emphasize that the 4 M's are interdependent. They do not exist in vacuums. Prescribing medication is a really good example of this. A medication might be great at treating a specific disease or condition, but that medication might have side effects that conflict with an older adult's mental health or their mobility, or maybe their ability to, eat the foods that they love or do something else that just really matters to them. And so this is why age-friendly is incredibly interdisciplinary. When our participating health systems establish their teams, they have a clinical expert from each of the 4 M's, in addition to several other leaders in their system, and they meet regularly. And so the idea is to take away the silos that these principles may have existed in previously. So I've spoken a lot about the theoretical underpinnings of this initiative, But what does it look like in practice? I know I'm a meat and potatoes person. I always want to know, wait, well, what am I supposed to be doing here? What actually happens? So I'm actually not going to say that much because our next speaker represents one of our phenomenal participants from last year's cohort, and she's going to speak more to what they did specifically. But essentially, when a healthcare system goes through this process, they are asked to assess and act on their practices in each of these 4 M's. And they get to pilot interventions and try them out and collaborate with their peers. A huge part of age-friendly work is co-designing with older adults. Social movements throughout history have been most successful when the targeted group in question is in a leadership role in the movement. So maybe you've heard the activist rallying cry, "Nothing about us without us." That is one of the founding principles of this work. So returning to my discussion earlier about the changing demographics, we are now catching up to how important this concept is when we work with older adults. And some of that is due to fundamental changes in human lifespan, and as well as American culture changing, and the approach to older adults changing. It used to be that lifespan was shorter. People would work until age 65 or so, and then if you were lucky, you got several good years and you'd take a cruise and spend time with your grandkids. And everyone said, you relax, we will take care of you now, sit back, we will make all the big decisions for you. And that doesn't really fly anymore. It's about when I'm thinking about my parents who are age 75 and their friends and the people I know in that age group. Everything is so different now. People are living longer, people expect more, people have more individualized needs. And it's time that healthcare needs to rise to that occasion. So this brings me to our partnerships with community-based services. Avital mentioned at the top of our webinar that one of the things I'm going to be speaking to are the collaborations that we've been able to achieve in this project. So we knew going right into this project that we did not want it to be just healthcare, because we all know that healthcare does not just happen in the hospital. One of the founders of AgeFriendly, Terry Fulmer, likes to say healthcare happens at the kitchen table, right? People are making decisions in their homes. People want to live at home. People are figuring out how to navigate growing older in a lot of different ways in their lives. Our partnerships with community-based services are really important in this work. Every county in New York has a local office for the aging, with leadership from the New York State Office for the Aging. And a lot of these county offices fund community-based organizations that provide exceptional services to older adults who live in the community. So I should admit here, I'm a little biased because that is the world I came from before 4 years ago when I began this work at Haneys. So I've seen firsthand, and we believe at Haneys, we see how the Aging Service Network has really been ahead of the curve in this way. The Aging Service Network has been asking older adults what matters to them and tailoring their services based on that for decades. It really is inspiring. So despite this rich network of community-based services, unfortunately, healthcare and these community-based services don't really have a lot of opportunity to collaborate. They are service networks that rarely intersect. They run on parallel tracks. Often when I go out and I visit, before the pandemic, I used to visit our members regularly at nursing homes and hospitals, and I would always ask them if they knew their local office for the aging. And a lot of the time they said, I know about it, but I just don't know who works there. I really want to know them. I just don't know them. And so we knew that we wanted to make that central to our work. So we built into our action community lots of opportunities for collaboration, opportunities for health systems and county offices for the aging to get to know each other, to be able to work together. So that collaboration is really central to this work. So I'll give you an example of a story we heard recently. I can't attribute this to our action community, but I think it really illustrates why this kind of collaboration is so important. So we heard about a New York County Office for the Aging that helped a woman who was refusing a necessary hospital stay. The hospital was not able to get her to commit to the procedure that she needed. She desperately needed this for her health, and she would not commit to it, and she wouldn't really tell them why. So at her local senior center, they knew her well. There was a case manager there that knew her, and they were able to really identify. They asked her, what is your barrier here? She wasn't really saying it at first, but they dug deep and they found out what her barrier was. It turns out she has a dog and she had no one to care for the dog. And the dog is the most important thing to her. and she was not willing. She refused to go to the hospital because she did not know how to get care for her dog. So the senior center was able to call around and got lodging for her dog, so she was able to go to the hospital and get the care she needs. Because this woman got the care she needed because the Aging Network asked her what matters. I just get chills. Like, I really have chills right now hearing this story, because this is the kind of collaboration that we want to foster with this work. So that's really the story of our age-friendly journey. My final slide, I'm going to brag a bit about the 37 systems who graduated from our action community last year. And I have to shout them out because this happened, this action community, we started doing this in early 2020, mid 2020. We were not sure what was going to happen. We were all set to launch our action community in April of 2020, and obviously we had to postpone it. But when we, when we started up in the summer in 2020, we were blown away by the number of health systems that were able to participate. Many had to postpone, understandably, but the degree of participation we were able to get during the biggest healthcare crisis in the last 100 years is staggering. So, and this year we have 40 systems enrolled. And we are just so blown away by the support and excitement with this movement that we are building. One thing we hear often from our participants is how meaningful it is to work tangibly to improve the lives and improve the care delivered to the population that is most vulnerable to the pandemic. That it feels good for them. And after years of struggling, it feels good to do work that is so helpful for this population in light of everything. And I know it's been the biggest privilege of my career to be able to lead this work for Haneys. And so with that, I'm going to turn it over to Laura from Bassett. And I want to thank you, and I hope that you'll all reach out to me anytime. I look forward to the discussion after we're done presenting. My colleague Morgan Black is here with me, and we will be able to answer any questions. So take it away, Laura. Oh, wait, let me see. Let me stop sharing. Okay.
Hi, everybody. I just want to start out by saying how happy I am to be here talking to you about things that are very important to me. Becoming age-friendly, this journey we're on here at Bassett Healthcare Network really has inspired me. I've been doing this work in this role as the Director of Quality for the network for really the last 6 months I came in. So I came in, kind of in the middle of the journey. Bassett Healthcare Network is right smack in the middle of New York State. We cover 5,600 square miles spanning 8 counties. Within our network, we have 5 hospitals, Bassett Medical Center, an academic medical teaching hospital, A.O. Fox Memorial Hospital, Acute Care Community Hospital, and then 3 critical access hospitals with 2 swing bed units within them. And they're in Little Falls Hospital, Cobleskill Regional, and O'Connor Hospital in Delhi. We have 2 skilled nursing facilities, 49 community-based outpatient health centers, 3 convenient care locations, 16 school-based health centers, and 2 ambulatory surgery centers. So as you can see, we have quite the dots all over this 8 county range. 2 years ago, Bassett Medical Center was in the first cohort and really did a lot of great work and had a lot of accomplishments with becoming an age-friendly health system. We are participating, and because of the COVID really jumping in, it delayed us in getting all the way to being a designated age-friendly health system. In the past few months, we have expanded, and we are now rolling this out to our whole system. And why age-friendly? Well, really, it's kind of a no-brainer for us. Age-friendly health systems are following an essential set of evidence-based practices. We're called to cause no harm, and they align with what matters to the older adult and their family caregivers. So our why at Bassett really is that it's aligned with who we are, with our mission, our vision, and our values. Our mission is to improve the health of our patients and the well-being of our communities. And we are aspiring to be a model of excellence for health, creating remarkable patient experiences and better living. And our values include courage, unity, and excellence. What's our why? Well, it matters. It matters to everybody. It matters to our patients. It matters to our caregivers and practitioners, and it's the right thing to do. So Dora had spoke about this a little bit, so I won't belabor this, but it means to be age-friendly is using these 4 M's, what matters, medications, mentation, and mobility, and really integrating them into our practice. These are initiatives and not programs. And really, if you think about it, it's a shift in how we care for our patients and engage them as part of our teams. It's really set up a framework across the whole continuum of care. Age-friendly health systems informs and enhances the other work, including the Care Partner Program and the Bridge program that we have at Bassett, which bridges the gap between the hospital and our skilled nursing partners. We really struggled with the idea of this being one more program, and so right from the beginning, we set it up that it's not a program. It's the framework, and it really just becomes ingrained into what we do and who we are. Looking at what matters to our older adults' needs and their goals and care, and looking at that, especially end-of-life care, and really across all settings of care, you know, that's really at the heart of this. Medications, mentation, and mobility also, they all fit together as one. We don't do them individually, we do them together as one piece. So for us, our journey, starting from one hospital, Bassett Medical Center, and then expanding and participating as an entire network, we set up our framework. We have a network-wide multidisciplinary team. And really, this is exciting because we have membership from all of our facilities and all disciplines. We have nursing, both leaders and frontline. We have physicians and clinicians. We have staff from our patient experience, from our pharmacy, from rehabilitation therapy. Our quality people are part of this, education, laboratory, and I think most importantly, our patient advisors that sit on this team with us from our PFAC, our Patient and Family Advisory Council. This has been the most joyful and biggest part of this work is actually having our patients as advisors sitting on this team to really give us their perspective as to what matters and really setting the whole tone. We have made a series of small changes, starting at one facility, and then when we have success, we adopt it across the network. And each of these small changes might be in one of our different facilities to really focus on the 4 M's, and it's kind of like divide and conquer. You know, each hospital, each facility has like their niche, what they're working on, and then they share and bring it back to the team, and we then expand it throughout. So some of our early successes and accomplishments thus far include under what matters, and actually some of these, they don't really all just fit into one bucket. They really kind of all feed off each other, but to help us with organizing them, we and make sure we're including all of our 4 M's, we kind of categorize them within the sections. We have had, like I said, active engagement and enthusiasm from our patient advisors on the PFAC Council. And I'm going to tell you a little story. We have our patient advisor, Walt, is our main representative on the Age-Friendly Health System team. And Walt is an absolute delight. He has a great sense of humor, and he has been really, he's accessed our care in our network all over the network. He's not just in one facility. He's been to many of them in many care settings. So he's really got a good picture of our whole network and where we're doing great and where we can improve. And he has been, you know, actively advising us as to ways that we can find out what matters from our elder patients, but also he's made recommendations from the PFAC to us. Some of these have come from him and from the PFAC team is looking at revising our paper maps to larger font and larger picture. On the back of the letter that goes out to our patients, telling them where their appointment is, they had a map on the back of it. And Advisor Walt pointed out to us that, you know, well, it's nice you have a map, you know, it's really nice, but I can't read it. And it's kind of centered in the middle of the page, and, you know, it's really hard for me to see, and it's hard for us. So, you know, a map is great, but we need to make it better so that we can use it. So we have switched it to a larger font, made the picture larger, and our patients are very happy with this. We're also, our whiteboards is an ongoing project of this, and we have made several changes and revisions, and it continues to be a work in progress as we learn what is more important. And one of the things that recently came to light for our patients is that they would really rather see the whiteboard be of use to them. Previously, our whiteboards have been very staff-centric, you know, so that the staff coming in can look and see, you know, things about the patient. However, the font on it was not real large. Again, patients have trouble seeing it, have trouble understanding what's on it. So our patient advisor is working with one of our teams to revise and make it much more patient-centric and patient-friendly. They don't really care what kind of assistance they need on there. If they're a 1 assist or a 2 assist, they told us very clearly. What they want to know is who their staff is, who's caring for them, and what their input is as to what their goals are today. So that's what we've been focusing on with our patients and the whiteboards. Care partner engagement is another initiative that we are working on, but really it's all entwined. It's all part of the same whole, in that when we are engaging our patients and their families or their care partner, we really are finding out what matters to them. So we've merged a lot of the work we're doing so that we're not siloed with this initiative, and this initiative. It's all one kind of whole, and that we're working on, and we seem to be able to accomplish more this way. And it's less, our staff are really working so hard. Our staffing, they're short-staffed. They're working harder than they've ever worked in their lives because of COVID and the recent, you know, loss of healthcare workers. So taking this into consideration, we have been very careful not to impose one more thing on the staff, but really kind of bring alongside them as another way to help engage our patients and take better care of our patients. So this has gotten us quite a bit of traction in working alongside there and really being partners and bringing our patient advisors on as partners. And so from the very beginning, we are looking to being age-friendly. Our advanced directives, working very hard to go, working very hard on our advanced directives, initiating them sooner rather than later. We've found that many of our patients come into the hospital, and we're having these discussions at the 11th hour, really, when we should have really talked about it, what matters with our patients, even before they came to the hospital, in the clinics, having these conversations and make sure they are communicated throughout our healthcare network, so that wherever our patients are in the system, we can intervene and provide them with the care that they deserve and that they want to have. This also involves, looks at earlier involvement of hospice care. We found in talking with our patients that patients were often being readmitted over the course of several hospitalizations. And then on the last hospitalization, we talk about hospice care, and they end up either being connected at the very last minute and either being able to go home, or they end up passing away in the hospital, which is not really what they had wanted or where the ideal spot. So we've worked on having these conversations in an age-friendly manner outside of the hospital, and then carrying that communication through. We've also made some updates in our electronic medical record with looking at the initial assessments and asking these key questions as to what matters for admission. You know, not just what matters, like how shall we address you, but really what are your values, and what is it that you would like to see happen as a result of this hospitalization. Medications, you know, we are currently working on changing up our after visit summary, again, as a request from our patients to add the indications for use for the medications in plain language. Targeted discharge education by pharmacy for new medications. Develop some side effect medication cards to hand out to patients when they're getting a new med, so they have it right, and they are bright and large print and easy reading for our patients. Fermentation, one of the new things that we are looking at and considering is developing a quiet time to facilitate rest. Both considering, and right now we have not implemented this as yet because it's still in the working process, but our team, which includes Walt, is working on developing times during the day, like perhaps in the afternoon for a 2-hour period, or then of course in the evening where everything settles down, to be a quiet time, where we commit as staff to really working on lowering the volume, working on providing, you know, decreased lighting, providing quiet music, whatever they like to do this rest time. Patients have said sometimes, you know, in the afternoon, they just want to have some time to sleep. So we are working on kind of setting up things, but that's still in the really early stages of facilitation. And then mobility, we added an additional 15 handicapped parking spaces at Bassett Medical Center to enable our elder folks or those with mobility challenges to access the hospital easier. It had been reported from the PFAC that, you know, really patients were having trouble finding handicapped spots, and there were never, you know, didn't seem to be enough. So our security folks took a look at it, and they went through and they changed and added 15 more spots at BMC, and we're currently looking at this in all of the other facilities as well, as identifying new handicap parking spots prioritized for our elders. And then also we're currently working on changing our fall risk assessment tool to better stratify our fall risks. and we're looking at the Hester Davis tool and really being able to individualize our care plans and identify our patients that truly are at risk for falling. So really, I thank you for giving me this time to share just some of the things we're doing. We are far from there. It really is a journey. It's not a destination. We are on this journey, and it's taking it day by day and step by step, and implementing things where we're able, small changes, and then we can sustain them and then add a next change. So it's really, really exciting work, and I'm so happy to be a part of this. Thank you.
Thank you. Thank you, Laura. Thank you, Morgan, Dora. This was great. So we have about 20 minutes for questions and answers and discussion. I have some questions to kick us off, and I'm monitoring the chat as well. So if others have questions from the audience, please chat those in and we'll make sure to get to those. I think as a starting point, one of the questions that just follows right on from your presentation is already in the chat that you might see. And maybe, Laura, you could just do a quick follow-up on the whiteboarding issue for patients. I think one of the questions was, could a whiteboard, or is this an idea that maybe you've thought of, include staff badges and photos for visual learners who might be connecting faces and names as opposed to the words on the whiteboard, or if they're too far away? So just curious if that's come up.
That actually has come up, and that's one of the pieces that that our team of advisors has suggested, so we're trying to figure out logistics of it to get it big enough so that they can see it from the bed, but also have it be a present. So they're looking at either putting it on the whiteboard, but they also have talked about having these brochures to hand out that they can have in their hand, with pictures of the staff. So they're looking at that. But that's a great idea. And
and one thing I wanted to add, not to address Pamela's question directly, but the theme of her question is a question we get often in this initiative, is that participants say, well, could I do this or could I do that? And a great thing about this project is that it is really flexible. We have an expert faculty member for each of the 4 M's, and the expert faculty member can help each participating health system to tailor interventions for their specific community needs. And that's one of the things that I think makes this project so forward thinking, because it acknowledges and reflects the diversity of New York State and the needs that our health systems have, and empowers them to make decisions, to make changes that are age friendly to their view.
Thanks. And actually, kind of following up on that a bit, is one of the questions that just came in through the chat was about what kinds of initiatives maybe have been implemented among post-acute providers. And then just generally, Morgan and Dora had asked, Laura shared with us some great examples of really specific things happening at Bassett in terms of changes. If there are any other, in addition to maybe answering that post-acute piece, any other initiatives that you think are worth just sharing with the group briefly?
Yeah, so thank you for bringing up that question. I'm going to speak more broadly to some of the initiatives that we've seen our participants implement over the past year or so, and then I can give some specific examples. But really the most common thing that we see in the first year of age-friendly health systems is that all of our health systems are already practicing some level of 4M's care. They may not be practicing it with every patient during every encounter, but they're already they've already kind of laid the groundwork, and they're looking for how they can improve. And so in that first year, you see a lot of folks, identifying the gaps, addressing them through quality improvement initiatives, and really, getting up to the standard of care where they want to be. In the second year, that's where you really start seeing people get creative. And so a couple of things that some of our returning health systems are working on, I'm going to shout out a couple of them, but Saratoga Hospital is one of our returning health systems, and they really spent their first year of age-friendly focusing on interdisciplinary communication and really targeting what matters most for their patients. And so upon gathering that information and addressing it, they were actually able to, see a couple of improvements across metrics that they didn't expect, such as, they were able to decrease their use of patient sitters in their memory ward, which was pretty exciting. You see a lot of things like that you don't really expect. But based on, the work that they did in their first year, they were actually able to, in their second year, partner with the Alzheimer's Association and really focus on providing training to, I think, nearly 200 staff across multiple disciplines in best practices in Alzheimer's care. And so it's interesting to kind of see when everyone starts with this broader program, to see kind of where people end up and what they end up focusing on. In terms of our post-acute care facilities, we've seen a lot of facilities that are attached to broader health systems. And so really what we see there is a focus on improved care coordination. If there's an EHR that doesn't necessarily talk to another EHR, really making sure that communication happens in other ways through warm handoffs or, just kind of filling the gaps across different care settings. And then also, focusing on just making sure that any conversations around what matters, which, really happen in depth in the post-acute setting, are communicated back to the hospital.
Great. And maybe I just pick up on one thing Morgan said in terms of the data and some of the health outcomes and process outcomes that you've seen. Can maybe all of you or one of you speak to how the Age-Friendly Health Systems Initiative integrates kind of baseline data measurement over time, what that looks like for sites in terms of where they're accessing their data from, or new measurement that they might need to put in place at the start of the initiative?
Yeah, so I can speak to that one as well. Kind of the first step for all of our health systems is to complete a PreWork package, and that is essentially just a survey of which older adults you're seeing in your health system. And so we ask that our health systems collect race, ethnicity, and language data, because really understanding, the patient characteristics and who you're serving helps you lay the groundwork for, improving health equity and addressing any disparities in outcomes. So once we have kind of an idea of who we're serving, also a breakdown of our patient's age and where we're seeing them, then we really start to focus on, if you're practicing some of the 4M's care already, are you measuring it? Are you documenting it? Is there a way that you're incorporating it back into the system and creating kind of a feedback loop so that you can improve? At the individual patient level, you'll often see a patient might have a mobility screening, but that's not recorded anywhere. And so then the next time the patient comes in, there's nothing to measure, is the patient moving as well as they were last time? And therefore there's no, goal setting or no broader conversation about the patient beyond that one encounter. And so really, starting with broad population level data and then really working on making sure that every patient has baseline information recorded so you can build upon that is really what we're focusing on. And then at a broader level, gathering information on what matters really helps you adjust your program and focus it on what's actually important to the older adults that you're serving.
Great, thanks. I don't know if others have something to add there. I have a follow on to that as well. So I guess the follow-on question to that is, something that we've talked a bit about and you all touched on is, that idea of engaging patients directly. And then more specifically to Morgan's point just now about some of the data gathering, how the initiative has maybe in Bassett, specifically in your healthcare system, or maybe Dora and Morgan, how you've seen across the health systems, how it's allowed them to either re-engage or engage some of those populations that may be experiencing health disparities, to close some of the gaps in terms of those disparities using an equity lens to some extent through this age-friendly work. I'm just curious if that's been a way that you've been able to kind of leverage this initiative to help engage populations that might have been disconnected from your care.
Well, one thing I want to speak to, I think this is another question that Morgan can handle flawlessly, but I do want to address the fact that we have been so fortunate to have in our action community 2 different FQHCs and a few other community providers that are really on the ground working with the homeless population, providing care to the most vulnerable people in our state. And I think that's really a major part of this work, is that it's not just, for the private pay, older adults, there's a lot more. The work is broad enough to really reach a lot of different populations. And we at Haneys have made it a priority to work with health facilities that work with vulnerable populations. For example, this year in our action community, we have several hospitals in some really, really hard to reach areas. And we are working with them individually to make sure that they're, to help them come up with ideas for interventions that are tailored to the needs of their communities. Morgan, if you have anything to add, feel free. Morgan works very, very closely directly with our participating systems. So she sometimes has more of the on the ground details than I do.
Yeah, that's great, Dora. I was actually also going to talk about our FQHCs. So
Great. Laura, I don't know if you have anything to add on that front, or we've got a few questions in the chat as well.
No, I didn't really have anything new to add to that, except, in looking at, being in rural New York State, really the access and healthcare literacy has really, we have some programs that we're partnering in with, but nothing that's just really hitting the nail. So
got it. Thanks.
I'm happy to address the question in the chat if you would like me to.
That would be great. So I think the question in the chat, I think everyone can see, but just the overlap between some of the Institute for Healthcare Improvement age-friendly designations and how that overlaps with some of the Medicare annual wellness visit, push and things like that. So I will pass it to you, Dora, to address that.
Sure. So in terms of the New York State Haneys-led action community and the IHI action community and the American Hospital action community, IHI originally worked in partnership with the Johnny Harper Foundation and the Hospital Association and the Catholic Health Association. They all work together to create this framework. And IHI originally started doing the action communities, leading the collaborative work groups and everything. But as part of the big spread, as part of trying to build a movement, IHI is now working with state associations like ours and a few other statewide organizations or local organizations to lead their own action community, just to make it less of this centralized thing under IHI. And that the good news is that allows these individual states or regions to tailor the work that they're doing, just like we talked about tailoring our work to be more inclusive of community-based organizations. I think that in the end result, I don't think there's a difference necessarily from an age-friendly health system that achieved that recognition after working with Haneys versus an age-friendly health system that achieved that designation after working with IHI or another organization. Ultimately, all organizations that go through this process need to be given their designation from IHI. So they all meet a baseline framework, a baseline deliverable of age friendly by their definition. I don't have a specific answer to the Medicare annual wellness visits question, but I do know that a lot of the age-friendly leaders are working with CMS and state agencies on how to incorporate this kind of work really broadly into all of the health systems and frameworks we have, such as Medicare wellness checks. So I do know that those conversations are happening. And I see a couple of recommendations and questions in the chat.
Yeah, so
Laura has it.
I would second that. Highly recommend. I use this. I keep it right on my desk here and use it all the time. It's very, very helpful and well written.
Great. So yes, we have a book recommendation link to purchase. And then I think, one other thing I'd love to talk about is some of the sustainability issues. I mean, Laura, you touched on how you've been able at Bassett to really spread across the system in your facilities. But I'm just wondering, in light of the designation from IHI and then really just sustaining the practices in the sites, what does that look like for sites in terms of spread and sustainability? I assume it's different across each site. And what are some of the challenges or opportunities that sites have in terms of resources to sustain the work over the long term? Laura, we can't hear you for some reason. Oh, Laura. Laura's sound seems to have.
Yeah, I don't know why you're sounding. It looks like you're saying something very exciting, and I really want to hear it. I'm not sure, you're not muted, so I don't know why we can't hear you.
It's okay. You know, why don't Dora, you or Morgan step in, and then Laura hopefully will get you back.
So, I mean, to address you're essentially asking about sustainability and the long-term vision of the initiative. I think that our vision is to get this kind of thinking baked into how health systems operate. This is not work that you do once and then just put it down forever. This is work that changes how you operate in the healthcare system. So I think our hope is that we would get to a point where, in my perfect world, every health system has this framework baked into how it operates, and that the way that it's operationalized is that it's no longer an effort to make yourself do it, because it's like breathing. That is the vision that I think we all would love to see. I'm sure that there are many other things that are going to happen to get us to that point. A lot of it maybe things like age-friendly booster shots over the years, for health systems. But I don't think the goal is to have health systems go through, age-friendly webinars and age-friendly assessing constantly. I think the goal is to really get to a point where it's baked into how the system operates. And I do think that the partnerships are really key to that. The partnerships are going to make a big difference, because no one can do this work by themselves. And so when a health system is age friendly and they are working with their local aging organizations, when they're working with their local health department, when everyone is on the same page about what age friendly is, then there's going to be a lot more success, because it's going to be baked into how everyone operates and communicates with each other.
Absolutely. No, that's helpful. And Laura, I think you're back on. If you unmute yourself, if you want to just finish up your thought.
Yes, I actually don't know where I left off. That was a little strange. I just kind of dropped off. Could you remind me what I was talking about?
The sustainability piece in terms of spreading across the system and the resources needed.
Thank you. One of the things that has really worked well for us with sustaining and making it all throughout the system is having that multidisciplinary team from everywhere that kind of reports back, but then go out and do the small changes in the work and come and report back and share it. And that has really helped us to and then when we see the success at one, then, we kind of decide as a group, all right, let's move it here and add it in and do it that way. And it's like little wins, but then it just gets to the end of the journey. So
that's great. And so I think we're just about wrapping up in terms of our time. Time flies. I think one of the last comments in the chat right now is how this might set up health systems for the next phase of the 1115 and Medicaid redesign waiver, which I think is a really good point. And obviously at the beginning, I noted that there's also the Master Plan for Aging for New York initiative underway, which I'm putting some more links in the chat about that as well for those who want to learn more and maybe engage on that. So as we close out, I'll just open it up to our presenters, maybe for one last thought in terms of, given all of the breadth of things happening at the New York State level, whether it's the potential DSRIP waiver or the Master Plan for Aging, what might be your closing thought on what's the most important thing that really needs to be kind of rising to the top that you've learned from this work?
I think that older adults need to be top of mind for everyone, for every policymaker, for every community leader, for every nonprofit manager. This is something that is going to radically reshape society. And if we don't, it's going to be a disaster if it's not something that we all think about. And so I'm really, really grateful for all of you for attending. I was really excited as I saw all the participants filing in, and we're all part of this whole movement together. And we're all here to answer any questions over email if you have any more questions.
And Morgan or Laura?
I believe that it really comes to engagement and engaging, like where we have had the biggest, it's exciting, is having our PFAC, our patient advisors as part of this work embedded into it. And, and they're the experts, they know. And so we have been involving them, and it's been very rewarding for everybody. So.
Great. So I think with that, we'll wrap up. I've shared a bit of resources in the chat so everyone knows. We'll be sharing around all of these resources with some additional information, links to things that might be helpful for you if you want to engage more, contact information for our panelists as well. Please take a look at the New York State Health Foundation events page. We have a lot of good events coming up this month in March. And with that, I would really want to thank you, Dora, Morgan, and Laura, for your time today. This has been really fascinating discussion. And we thank you for all the dedication to this work and for older adults across New York State. So I'm wishing everyone a good and healthy afternoon. Thank you.
Thank you.